Have you been struggling with migraines or chronic headaches that can be maybe one side or maybe both? Or maybe it's throbbing or pulsating. Maybe you're sensitive to light, sound, touch, or maybe even smell gets you irritated. Or maybe you're also experiencing nausea or vomiting on because of how bad the migraine is. And you've been everywhere, you've been to the doctor, and nobody can point a finger because all your labs and tests come back normal. And they give you some medication for the headaches or the migraines that work temporarily, but you wake up the next day right back where you are experiencing migraines. See, in our office, what we find, there's a common denominator, very common denominator to migraines, and it's an upper cervical misalignment. Let me explain. See, when there is an upper cervical misalignment and that bone shifts out of position, whether it was from a car crash, a sports injury, a big fall, or maybe even repetitive use over time with bad posture, your upper cervical spine misaligns and can affect multiple processes in your body. For example, blood flow. When your atlas is shifted out of its position, it can put pressure on your vertebral artery, decreasing blood flow to the brain, which could contribute to migraines, headaches, brain fog, cloudiness. But also, when that bone shifts out of position, it can also disrupt your CSF flow and drainage from your brain down to your body and your lymph nodes to get all that gunk out, which means you have an increased pressure in your brain, which could then be why you're experiencing that throb or those pulsating, is because there's excess pressure. And if this sounds like you and you've been struggling with migraines, whether on both sides, whether on one side, but they're debilitating, they're preventing you from getting to work, they're preventing you from getting up in the morning, and you're tired of it, send us a message. Let's get you checked. Let's get you corrected. Let's make sure that your upper cervical spine is in alignment and moving properly so that you can finally be migraine free and be productive and get through your day without having to take medication one more time.